But first, I'm joined by Shirley Cramer, Chief Executive of the Royal Society for Public Health. Hello, Shirley. Lovely to see you again. So this year, the Public's Health Across the Lifecourse. And of course, this highlights the fact that we have different challenges at different points in our lifetime.
We're particularly excited by this year's film, partly because the Lifecourse is something that we're really concerned about in public health. What we really want is for everybody to have the healthiest, happiest life they possibly can, but there are challenges at different points in your life. So in the early years, every child deserves the best start in life, and for many children that's not the case. So we need to have good programs in place, make sure that every child is vaccinated, all of those things to improve and protect the chances of that child have a good life. Of course, then we've got children in school and young people, and there are lots of challenges around risky behaviour, education, understanding and gaining knowledge about what's good for you, what's not so good for you. Middle ages, we could be really complacent about, not eating properly and not exercising enough, and the stresses and strains of normal life with mental health issues and, lots of issues around that. But what we do know very clearly is that we need to do more in our middle years to make sure that we have the healthiest possible older age. And that's really important for most people.
That segmentation seems like a very sensible approach, but how does it actually work in practice?
That's very interesting, because I think local authorities have the responsibility for public health, and often it breaks down into the kind of programs you might be offering, universal programs. So, for example, the role of the health visitor in the early years, giving the right kind of information to new mothers, pregnancy, making sure that mothers know why it's important not to smoke or drink during pregnancy. All of these things in a universal way make it better. One of the things at the Royal Society for Public Health that we're really concerned about, along with colleagues in the field, is health inequalities. These are growing, and so some children have a really good start in life, and they're usually from the wealthier families, but other children have really a poor start in life, and we need to bring them up. We need to make sure we have those services and programs in place around nutrition, education, and healthcare that really help all those children.
So, having identified some pinch points, presumably you're focusing a lot of your attention on the areas that are not being dealt with adequately.
Childhood obesity is something that we're concerned about, and there's really lots that needs to be done around advertising and promotion of unhealthy food and drink. And one thing we've done this year is an upselling, highlighting the fact that this is happening to all of us, having a larger coffee or offered fries with that when actually we haven't asked for it. We know the public actually don't really like this, and so we want retailers and others not to be offering these kind of unhealthy foods in an upsold way. Upsell us some healthy food, that's what we like to say. There's been the pinch points around being older, and falls prevention is a really important aspect of what's happening around the country now, and lots of the fire services on their safe and well checks are really looking carefully to prevent falls, and they're doing this by talking to people in their homes and putting in proper equipment. Another area is the arts and health, which has really moved this year into a prominent position. So helping older people with core balance is happening through things like Dance for Health, helping lung capacity if you have COPD through choirs, community choirs. So there's a whole host of things that help people's mental health as well as their physical health.
So, having highlighted a number of challenges, what would you say is top of your agenda this year?
Probably young people's mental health. Our Young Health movement and the work we're doing around that to promote resilience in young people, to help prevent some of the terrible statistics we're seeing at the moment about self-harm and mental health, depression and anxiety among younger people. And we need to be able to cope with this. For adults, we've been rolling out a programme across the UK called Connect 5, and that really helps people to work on their own resilience, to know what how to deal with the issues. And we need to do something more for young people in that area.
Well, Shirley, it's always a pleasure talking to you. Thank you very much indeed for your time today. Thank you.
Thanks.